Peter Marocco's letter to UNAIDS, terminating U.S. involvement, delivers a crushing blow to a vital global health service. The Trump administration's decision to cut funding for the Joint United Nations Program on HIV/AIDS, UNAIDS, represents a devastating setback in the fight against this deadly disease. This move, the latest in a series of actions dismantling U.S. participation in crucial global health and anti-poverty initiatives, marks a stark retreat from international responsibility and a betrayal of vulnerable populations worldwide. The termination notice, issued by Peter Marocco, a staunch Trump loyalist, underscores the administration's relentless pursuit of dismantling the U.S. overseas aid program through USAID. Marocco, acting as a key architect of this dismantling, has systematically targeted programs designed to alleviate suffering and promote global health, leaving a trail of devastation in its wake. His actions speak volumes about a disregard for human life and a cynical prioritization of narrow political agendas over the urgent needs of millions. The ramifications of this decision extend far beyond mere budget cuts. It represents a profound erosion of global cooperation in combating a disease that continues to claim countless lives annually. The implications are particularly dire for countries heavily reliant on U.S. aid to sustain their HIV/AIDS programs. These nations, already struggling with limited resources and infrastructure, now face the daunting challenge of bridging the funding gap left by the U.S. withdrawal, jeopardizing hard-won progress and potentially triggering a resurgence of the epidemic. UNAIDS Executive Director Winnie Byanyama's stark warning on social media paints a grim picture of the consequences. She reports that 55 countries have already experienced significant disruptions to their HIV responses due to the U.S. foreign aid pause, a direct result of Morocco's actions. These disruptions threaten the provision of essential services, including life-saving medications, testing, and counseling, leaving vulnerable populations exposed and at risk. This decision is not merely a financial setback, it is a moral failure. It reflects a callous indifference to the suffering of millions and a reckless disregard for the principles of global health cooperation. The Trump administration's actions send a chilling message, undermining international efforts to combat HIV/AIDS and setting a dangerous precedent for future global health crises. The consequences will be felt most acutely by those least equipped to cope, perpetuating cycles of poverty, suffering, and preventable death. The world community must now rally to mitigate the damage inflicted by this short-sighted and deeply damaging decision, filling the void left by the U.S. withdrawal and recommitting to the global fight against HIV/AIDS. The lives of millions depend on it. This act of unilateral disengagement threatens not only the health of countless individuals, but also the very fabric of international cooperation and the global pursuit of a healthier, more equitable future. The international community must respond swiftly and decisively to avert a catastrophic humanitarian crisis.